Trust. It's Monday here on The Story. And tonight, Metro's supportive housing services tax, that's the one paid by high-income earners to help fight the homeless crisis, it could be changing and extended by 2 decades. Not everyone's thrilled.
And I truly believe, colleagues, that changing this in midstream is really a huge policy mistake.
We've got a live interview with Metro's president whose proposal could come to voters this spring. Plus, our coverage of the historic Providence healthcare workers strike continues. It's day 4 and a member of the nurses union joins us live in just a few minutes. It's our big story tonight. Today, Providence said they are close to resuming negotiations with 6 of their hospitals, but that does not include the 2 largest. That's Providence Portland and Providence St. Vincent. And instead of trying to find a compromise this afternoon, Providence filed a complaint against a group affiliated with the Oregon Nurses Association, claiming they have not been bargaining in good faith, refusing to meet, quote, at reasonable times and reasonable intervals. The union called that, quote, categorically false in the height of irony, saying Providence is the side that consistently refused to negotiate. So the blame game is on full display just a few days into this. Nurses KGW spoke with on the picket lines this morning say a key demand is a more competitive salary, something closer to what OHSU nurses make, which is apparently around $60 per hour. One nurse on the picket line today actually crossed the line the first day of the strike, but joined fellow nurses outside after that.
I crossed the picket line last Friday. And I realized that it's a very unsafe working condition, and I decided that I am going to defend my license instead of putting it at risk by working.
So on Friday, the first 16 minutes of our show was dedicated to talking about the first day of this historic strike. I started my day at the picket lines hearing from striking nurses and physicians. And I'll tell you, it was hard to find nurses who wanted to talk on camera. Those who did, we featured in the show. Then we caught up with a few patients leaving the hospital who had just been seen by those replacement nurses inside Providence St. Vincent. Overall, they told me it seems like things were operating normally, albeit perhaps a little slow. Now, after getting some of that side, we talked with the chief executive of Providence, Jennifer Burrows, live on the show. And we've followed that interview with a soundbite and another live interview from 2 Oregon congresswomen, both supporting the striking healthcare workers. However, that coverage sparked emails like this one from Susan. She says it would behoove you as a professional to give due justice to both points of view and talk to the ones that are affected by Providence's decisions. That would be the healthcare professionals and patients and their families inside. It is not all fine, as Ms. Burrows is trying to advertise. So I gotta say, our team was a little confused by emails like that one. And trust me, there were a lot of them, because we did get that side. In fact, we aired it before our interview with Burrows. But that live discussion with the leader of Providence didn't sit well with many of you who flooded our inbox with messages like this one from Cindy. She says Jennifer Burrows skewed truths and only delivered inflated information that she wanted to tell you and make the public believe. Angela wrote to us, "The lies management tells have gotten bigger and bolder as the years have gone on. I and many of my colleagues are on the strike line because they, particularly Jennifer Burrows, have taken those lies to the next level, and we just can't stand for it." So this war of words between Providence and the nurses union, with patients caught in the middle, continues with no end in sight. All right, so joining us live now is Gina Ottinger. She's a striking RN who worked in the emergency department at Providence St. Vincent. She is also on the bargaining team there. Gina, thanks for joining us tonight.
Yeah, thank you. I appreciate the opportunity.
Of course. So, all right, it's day 4 of the strike today. We know pay and staffing are among the top concerns. Are there other concerns that nurses like yourself have?
Yeah, I think this ultimately is about patient safety. And I think that's why nurses are speaking up. I honestly think that's why we're coming forward. And it's really hard for nurses to do this. We really just want to be at the bedside. We want to take care of our patients. And Providence has proven they're not letting us do that. And that's why you're seeing all of us come together. I think I'm really feeling moved by our providers who have joined in because they are seeing and feeling the same things. we're seeing systemic problems. And now you have 11 units that have decided to, come together because our voice has not been heard. And that's why we are so passionate. And I'm not surprised you got a lot of feedback, because Providence likes to have the optics that they have it all under control. And we're telling you, no, they don't. They need to come back to the table and work with us so we can get a fair contract.
So where does that bargaining stand right now from the union's perspective? We know that St. Vincent is not on the list of hospitals that Providence appears ready to negotiate with.
Correct. And I think that right there saddens me the most, because it really feels very insulting and disingenuous. Because if they really wanted to bargain, we'd all be there. And I think that's what we are standing for, because enough is enough. We have said, this is what we need. We need you to listen to us, and they haven't listened to us. And that's what I think every nurse wants the community to know. Your nurses are out there, not because we don't want to be at the bedside. I 100% want to go back in that hospital and be there, but I'm not going to be there until they come back to the table and start to bargain with us, or negotiate is a better word for it, I suppose.
So as we mentioned, we got so many emails from nurses both in and out of Providence after my conversation with Jennifer Burrows, the chief executive of Providence, on Friday. So we wanted to ask you about some of the claims that she made. First, the one that came up in most viewer emails was, it says, a typical acute care nurse that has been in practice for a few years makes an average of about $125,000 a year. Is that true?
I think that's a gross exaggeration. Gross exaggeration. I have a daughter who is actually a nurse at St. Vincent herself, and she does not make anywhere near that. So when you have those optics sent out to the community, it's really deceptive. I don't think that's a true fair wage that is being proposed. And when you compare us to other Portland Metro hospitals, we are still well below that. We're losing nurses all the time, not just because of the wages, which is only part of it. It's really more than that. It's about the benefits, and it's about the care we provide. We are really there and trying to provide the best care we have. But if we're not retaining nurses, then we have less nurses to provide that care, and it makes it harder for all the rest of us.
So speaking of benefits there, how about this one? Burrows said it concerns time off. She says on average, a new graduate nurse gets 23 days off a year, and on average, a 7-year nurse gets 28 days off a year. Talk about how that's misleading, if it is.
Again, I think it's more about the whole picture, and I can't give you exact numbers on that, but I can tell you we are still well below our peers in the Portland metro area. And that is why we have nurses leaving constantly. And we're always in a deficit. I still have travel nurses in the emergency department right now that are providing care, and not core staff.
So talk about this new staffing law on nurse to patient ratios. I'm trying to wrap my head around this. Walk us through what that is supposed to do and why the union and Providence, you guys don't seem to agree on how to implement it.
Yeah, I mean, the staffing law, I was a huge advocate for it, and I still am very, very thankful for it. It is a step in the right direction. Unfortunately, what we've experienced is the hospitals within Providence, they have really not come together to help us solve this issue. They have actually been an obstacle in it. And I've actually been very involved in the staffing committees, housewide and both on my unit. And we have things called staffing plans that really help us take care of patients so that we are paying attention to their needs and providing quality care. The hospital currently is wanting to eliminate detailed staffing plans that really articulate ratios dependent upon a patient's needs. And while the staffing law is amazing and has allowed for breaks, which is something that has been overlooked for years in nursing, it has come at the cost of increasing ratios within Providence, which has been across the board in every hospital throughout the region. Instead of understanding that we want our breaks, but we also need to have ratios for a reason, and nurses are hugely passionate about evidence-based practice. And a lot of these staffing plans have evidence-based practice in them that is supported by research that says this is how we should take care of our patients. So it's really important that we keep those plans in place and have articulated language that defines that. And right now, they're not agreeing to any of it.
Okay, well, thank you, Gina, for your time tonight. We really appreciate you coming on the show.
I thank you.
Okay, so now it's your turn. What is going through your mind? We heard from Providence last week and the nurses union tonight. Are you picking a side? Are you a patient that's feeling the effects of this strike? Let us know. Email the story at kgw.com or call and leave a voicemail, 503-226-5090. All right, turning now to a regional tax in the Portland metro area. And before you fall asleep at the mention of taxes, this one you should care about. The Supportive Housing Services Tax. It's meant to help end the homeless crisis. You may have seen the tax in headlines as the SHS tax and how Multnomah County struggled to actually spend the tax revenue the first few years. But just 4 years after it was implemented, there's a proposal to change it. Today, I dug into what that could look like. Changes could be coming to a controversial tax called the Supportive Housing Services Tax. You've likely heard of it if you live in the greater Portland area, covered by the regional metro government, which includes Multnomah, Clackamas, and Washington County. The voter-approved tax has been in effect since 2021 for people who make $125,000 and couples who make $200,000 annually. The tax is 1% on all income made above those thresholds. That 1% is money meant to address the homeless crisis, playing out on our streets every day.
Rapid response is coming and clearing us out. Hopeless, kind of. Like, it just feels like alone.
Metro's Council President Lynn Peterson is proposing these 6 changes to the Supportive Housing Services tax. They include forming a new committee to improve program accountability, putting the money toward affordable housing, extending the program an additional 20 years until 2050, and raising the income threshold while lowering the tax from 1% to 0.75% in 2031, taxing money made above the thresholds. At an October meeting, county leaders, many from Clackamas County, where voters were not for the tax in the first place, expressed skepticism over these proposed changes.
If it isn't broken, what are you trying to fix here?
And reducing tax revenues for SHS will certainly result in backtracking and community harm.
The changes you are proposing with this resolution would disrupt our program and destabilize our ongoing success. Just as we're hitting our stride, you would force us to cut services and put people back on the street.
And I truly believe, colleagues, that changing this in midstream is really a huge policy mistake.
Metro proposals to change direction would risk slowing our progress and putting our SHS goals at risk. And that's something that none of us want to happen.
While this tax money has provided housing success for some, in recent years, Metro collected way more than they had forecast, to the tune of about $50 million. Multnomah County was criticized for not getting the money out the door fast enough, while people like Richard tried to get off the streets.
It's actually extremely hard to get housing. I know I've probably turned in about 5 or 6 applications to different houses that they have, but have not gotten any emails back or phone calls or anything like that.
As the Metro Council considers changes to the SHS services measure, I want to express my commitment to our shared goals. More transparency on how funds are spent, clearer performance metrics, helping those most at risk, and creating a pathway to permanent housing.
It'll be a pleasant surprise, but until it's done, I'm hesitant on accepting that.
Now, the Metro Council will consider the president's proposal in the coming weeks to decide whether or not they will send the measure to voters in the May 2025 election. Any proposal must have majority support from Metro Council, 4 votes among the 7-person council in order for it to be referred to voters. The council is scheduled to hold a work session about this on Thursday. The first public hearing on this is set for January 23rd. Okay, so we want to bring in live now Lynn Peterson, Metro's president. Lynn, thanks for coming on the show.
Thank you for having me.
So first, and to echo some of those county leaders that we just heard from, why make changes to this already controversial tax, which appears to be working in some areas?
It's a great question. This program has really helped thousands of Oregonians off the street, but it's set to end in 2030. That is about, 5 years away. And what that means is that our county providers will start to need to look at a ramp down very soon. And I know that we all don't want to be in the position of having all those folks back out on the street or putting any more people at risk. So we are looking at the issues that the service providers are already facing now in winding down those budgets. But I am certainly not going to be looking to ask the voters to extend this program without any reforms to oversight, governance, and a lower tax rate.
So after listening to concerns from county commissioners, many of them say they're afraid that some of your proposed changes will jeopardize the good work that's already being done. What do you have to say to those concerns?
Yeah, no, we've listened very hard to the issues that the three counties have raised, as well as providers and those with lived experience. And what I can tell you is that nobody wants to go back. Nobody wants to jeopardize the good work that has been done. But I believe that there is no way that we should be putting out a mission accomplished banner behind any of us by any means, because we still have a lot of work to do. We are faced right now with a huge surge in evictions in a region that exceeds 10,000 people per year in the metro area. And so one of the reforms we're proposing is to allow this money to be used to build housing, which can make sure we have enough homes for all of our region's residents. And more housing also ensures that when we're moving people off the street, it's towards long-term stability.
So a sticking point, though, for many county leaders is that they aren't in favor of cutting the tax rate from 1% to 0.75%. So why do you want to cut it?
Well, certainly you brought up the fact that we have been bringing in more money than we had anticipated. So we believe that there's room to be able to do more and allow for more folks that are middle income but have gotten caught in the high income tax bracket as inflation increases, to move them out. So that's the first thing. And one, we want to provide some relief in the region so that we can actually make sure that everybody has the opportunity to succeed in our region.
So watching that meeting, something that caught my attention, Clackamas County commissioners, they see this whole thing as having to pay for Multnomah County's mistakes. And what I mean by that is, Multnomah County has been criticized in the past for not spending this money in a timely fashion. And other counties feel like they're being punished because of it when it comes to, say, setting up like an oversight committee. What do you have to say to that?
I think, again, all three counties have done a very good job in growing their programs, but what we have not been able to achieve is a regional program, so that no matter where you enter the system geographically or how you enter the system, whether that's through mental health requests or addiction services, or just by the fact that you're asking for either a shelter bed or permanent supportive housing, we don't have a regional system. So what we needed to do is, in order to get that efficiency and be able to build more housing, is we have to grow this to a regional system. And that's what our oversight committee has been asking for. But we found that the oversight committee structure that was created in the last measure doesn't have the teeth to actually get us there.
Okay, well, Lynn, thank you so much for coming on the show. We appreciate your time.
Thank you.
All right, so should the supportive housing services tax stay the way it is, or do you think the president's plan is the right path forward here? We love to hear your feedback. So email us the story at kgw.com or call and leave a voicemail 503-226-5090. All right, we're taking a live look outside at the Rose City tonight. Chief Meteorologist Matt Zaffino joins us after the break to talk about tonight's wolf moon, the first full moon of 2025. That's next when the story returns. Well, welcome back. Chief Meteorologist Matt Safino joining us now. Matt, talk to us about this full moon tonight, this wolf moon.
Yeah, it's one of my favorites of the year because it's called the wolf moon, right? It would be a lot better if we could see it, but fog and low clouds preventing us.
Oh, lame.
Completely lame, right?
I was all excited.
Call it a lame duck, but it's more like a lame wolf moon because we can't see it.
Okay.
But other parts of the state can. Like at the coast, you'll get a view. Parts of eastern Oregon and up in the mountains will get a view. But every moon has a name, right? Going back to folklore or to Native American traditions. And this one is called the wolf moon in the month of January because it's when, according to legend, the wolves were howling. Oh, like that.
What's my moon? I'm October.
You are October? Well, you get the hunter's moon.
Ooh,
the huntress.
Okay.
Yeah, no, that's a good one.
I'm here
Right down
for
there
it.
on the list. I love that one, actually. It's one of my favorites. And the hunter's moon is cool because it's like the harvest moon in that it rises in roughly the same place for several nights in a row. So that's a good one as well. But this month, it is the wolf moon. Next month, on February 12th, hopefully we'll have a clear sky. It's called the snow moon because that's when the snows were deep in the middle of winter like that, too. So there you go. The wolf moon. Not visible tonight. The other thing that we would be able to see, Blair, if we had a clear sky, are like 4 planets. We've got Venus in the west, Jupiter rising in the east. Mars is being occluded by the moon itself, meaning that Mars goes behind the moon. You could actually see that if we had a clear sky.
Yeah, what a terrible time for fog.
It really is. All right, we're going to switch from moon to sun and talk about sunrises briefly because today our sunset, sorry, I said sunrises, sunset at 4:51. A week from today, though, we cross the 5 o'clock threshold, which is always exciting. At the end of the month, we pick up basically about 25 minutes from where we are today, the sun setting 25 minutes later. And by the end of February, of course, it's nearly 6 p.m., so the days are getting longer. Switching gears, and I'll look back on 2024 a bit, which globally, the warmest year on record, going back to 1881. I mean, look at the trend here from the 80s through the 90s to now. So yes, that's a little bit disturbing. We keep seeing years warmer and warmer, and not just globally, but here in the U.S., same trend. If you look at the 10 hottest years on record, they all have occurred since 1998. 2024 tops the list. That, of course, plays into the fire situation down in Los Angeles, along with the lack of rain. They've had virtually no rain in the last 9 months. Bunch of rain first part of the last year, but nothing in the last 9 months. So it's been very hot. It's been very dry. That's part of the problem with the fires down that way. Here in Portland, here we go. Second hottest year on record, led by the hottest July we've ever had. Blair?
All right, Matt, thanks so much. Stick with us. We're back after this. Well, that is the end of our show, folks. Thanks so much for watching. An Environment Northwest special is coming your way next. And remember, you can stream the story on your own schedule. Just download the free KGW Plus app, available now on Roku, Apple TV, and Fire TV. Enjoy your Monday night, and I'll see you right back here tomorrow night at 6:30.